Hi, everybody. Thank you so much for coming. My name is Christy. I'm the office manager at the Greenboro Family Medicine Center. I have Dr. Benoit Robert here today. He's going to put on a presentation for you guys with respect to COVID-19.
Thank you very much, Christy. And thank you everybody for showing up for some important times. The coronavirus has been around for quite some time. And we know that it's called the coronavirus because in Latin, the name for a crown with the jewel sticking out is called a corona. And these spike proteins under electron microscopy look much like a crown. These have been around for quite some time. Some of you may remember the SARS epidemic. And right here is the spike protein. So the thing to remember about COVID is that most people will have very few symptoms. Now, but if you do have symptoms, the commonest ones are fever, dry cough, and fatigue. And then less common are the aches and pains, sore throats, loss of smell or taste, headaches, and so on. And of course, the serious ones, the ones that will land you in the hospital, are the ones that include difficulty breathing or shortness of breath, chest pain, pressure, loss of speech, or movement. Again, a lot of people will not have symptoms, which basically means that you are contagious, even though you don't know that you're actually having a disease. So when it comes to COVID, a lot of people are misunderstanding of how deadly it is. So if you're over the age of 80, you have a 20% chance of dying. And as you start getting younger, you can see that the chances of dying for that is much smaller. What we found here in Canada is that over the age of 80, we actually had a 30% mortality rate. Now, for those of you who are in the 20 to 29 age group, the number is 0.03% or 300 deaths per million infections, and that number is quite important. So again, when we looked at how COVID impacted on Canada, we see that most of the people who've been infected, or most people who've been died from COVID, are over the age of 80, and very few under the age of 19. So when we're talking about a vaccine, the first thing to remember is that you'd rather prevent. So social distancing is important. Washing your hands is important. Wearing a mask and wearing a visor or eye protection is important. And we know that everybody's been doing a great job with that, because when you compare to influenza, the influenza rates this year have been incredibly low. And this just shows how much more contagious COVID is. So when prevention doesn't work, we start looking at vaccines. And a vaccine is any substance that's used to stimulate the production of antibodies and provide immunity against one or several diseases. So we've heard a lot about mRNA, and what is it? Well, mRNA, first of all, is not DNA. DNA actually makes the mRNA. And the mRNA then makes the spike protein, which is what we recognize and start fighting off. That's what triggers the immune response. Now, part of the reason the vaccine was delivered so quickly is due to many, many things that occurred at the same time. First of all, China released all the information they had on COVID early on, and all the various countries collaborated. Drug companies already had mRNA, so it was easy to modify it. The drug companies took a big financial risk and started building production facilities while the vaccine was being developed. As well, there is a pandemic, and there was a pandemic, so there were lots of people to compare, and it only took 4 months to prove a huge difference. Most new vaccines approved with only about 10,000 people. For example, the HPV vaccine for teenage girls is tested on 13,000 people. For the COVID tests, vaccine tests, usually groups of 40,000 or so. So we use mRNA because the mRNA will produce the spike protein, much like a factory. And so the companies would be making this, the companies making the spike protein as a vaccine need to spend more time making it. The other thing that was important is that the countries looked at validating this vaccine, or approving it, if you will, differently than before. In the past, they would wait for all the information to come in and then start sorting it through. But imagine if you started looking at the information as it came in, so that when you're building your wall, or you're building your information like this, you can see that the approval will be much, much faster. And the last thing to remember is that the companies do not worry about how stable the vaccine is. And so mRNA is quite fragile, and this is why we heard all this information about it needing to be very, very cold. So I'll be talking about the approval process for the Pfizer vaccine, but it was very similar for all the other vaccines. So they took 40,000 people from a variety of countries and divided them into two groups. One group received a placebo, or a fake vaccine, that's the gray group, and the blue group received the real vaccine. And so when you look at this, within 4 months, they realized that the blue group was getting very few signs or symptoms of COVID. As a matter of fact, each dot represents 8 people, and there was only 1 dot. In the group that had a fake or a placebo vaccine, 160 people got sick, or 20 dots, and 9 of those were severely ill. So when you start looking at who should not get a vaccine, well, basically, very few people should not get the vaccine. However, if you had a history of anaphylaxis after any vaccine, in other words, you require an EpiPen or transport to a hospital, then you would be at high risk with any other vaccine. If you've had a reaction to this COVID shot, so of course, for the first one, you are unlikely to develop an anaphylactic reaction, but if you do, you should not get a second shot. And then if you have symptoms of an infection, whether it's confirmed or suspected COVID, then in order to get the best immune response, you should wait for that infection to clear. Some of the cautions, though, is, and in order to get the best immune response possible, is to not receive another vaccine within 14 days, either before or after. And if you're on medications that can decrease your immune system, for example, some rheumatoid arthritis or cancer treatments, then you might not develop the same amount of immunity as somebody who is not on those medications. And of course, if you're on blood thinners, I would expect a higher chance of bruising. So some of the side effects of the vaccines, and these are common for most of them. So very common, of course, pain, headache, tired, muscle or joint pain. Less common, redness or swelling at the injection site. And then very rare are the serious side effects like anaphylaxis, as I mentioned. There's a lot of talk about PEG, or polyethylene glycol, with respect to the Pfizer vaccine and whether you're allergic to it or not. But PEG is used very commonly. It's used as a laxative, it's used in some intravenous medications, in many cosmetic creams, as well as in many medications like that are in capsules, like Advil or Tylenol or Benadryl. Now, the other vaccines, I've talked about mRNA, but now there's also other vaccines that are developed that are through viral vector. And so AstraZeneca and Johnson & Johnson use this approach to vaccinations. So they use a virus called the adenovirus, which is the virus for the common cold. And this virus has been modified so that you do not get any symptoms of a cold. And it's been changed so that once you're vaccinated, you will produce the spike protein, and very much like what we do with the mRNA. So this type of vaccine has been used for rare diseases like Ebola and Zika. And the time to immunity, like the other vaccines, is 10 to 14 days. Sorry. So does it work? Well, when we look at Pfizer, you can see that after 10 to 14 days, very few cases of COVID. With Moderna, if you get the real Moderna shot, very few cases after 10 to 14 days. Same thing with AstraZeneca, and also the same thing with Johnson & Johnson. Currently, Johnson & Johnson has been approved in Canada, but we do not have any available yet. So we've heard a lot about the clotting, and it's very low incidence. 1 to 4 people in a million might suffer a clot, typically 4 to 6 weeks after the vaccine. It appears to be more in women, particularly under the age of 45, and we're not quite sure what the mechanism is. However, we do know that there is a similar mechanism that occurs with people who get a natural blood thinner that we use. And we know that people who get COVID have a much higher chance of clotting. So when you start looking at what are the odds of this happening, because some people are quite fearful, and I would understand. So the odds of winning a lottery are 1 in 14 million. The odds of being hit by lightning are 1 in a million. The odds of getting a clot from the AstraZeneca vaccine is 1 in 250,000. The odds of getting a clot from the birth control pill is 1 in 100,000 over 10 years. And the odds of dying from COVID on average are about 1 in 3,000. So the key messages are, first and foremost, the best vaccine is actually the first available vaccine. What people don't realize is that the effectiveness is essentially the same with all 3 vaccines. In other words, once fully vaccinated, you have a very low chance of being hospitalized due to COVID. So it's close to 100% no hospitalization with AstraZeneca, 100% with Moderna, and 100% with Pfizer. The difference between these vaccines is primarily with the symptoms that you get of COVID should you fall ill with COVID after being vaccinated. So with Moderna and Pfizer, 95% of the time, you will have very few symptoms, and only 5% will you have significant symptoms. However, it will not be enough to send you to a hospital. When it comes to AstraZeneca, 65% of people, so only 2/3, will have very few symptoms, and 1/3 will have some symptoms of COVID should they fall ill with it. However, like Pfizer and Moderna, the chances of being hospitalized is close to 0. So the mortality rate is reduced, severe disease is reduced, and when you get the side effects of the vaccine, it seems to be somewhere between a flu shot and a shot for shingles. Now, for those of you who want the most latest information, there's the Center for Effective Practice, or CEP, that has all the information and is updated regularly. So you can see here the efficacy rate with just 1 dose, okay, against severe disease is with fully vaccinated, I'm sorry, is very, very high. It appears that with the newer variants coming in, that we may not be as protected with the vaccines, but we will be more protected than if we did not have a vaccine. On to you, Erin.
Thank you. Before I go to the slide, I just wanted to remind everybody that you're welcome to ask questions in the Q&A. We'll try to answer them either during or after. But yeah, so before your vaccine, so you'll receive, depending on where you go, you usually receive a information package. So you'll have basically what's called a pre-package alongside a consent form. So you want to make sure that you completely read through your pre-package just to inform yourself as best you can. Get all your questions answered prior to arriving for your appointment. A lot of these places tend to move like a well-oiled machine, so you kind of want to have everything out of the way and be confident in your decision when you get there. Complete your consent form, fully read it through and make sure it's signed. Review the clinic flow. So all vaccination centers and locations have a flow because we want to make sure that we limit contact between patients. So review what is asked of you. Don't arrive too early. Make sure that you follow the directions that are given to you.
Sorry, Erin.
Yeah.
Sorry to interrupt you. I just had a comment here. Some people are finding it a little hard to hear you. Would you mind just speaking up a little bit?
No, not at all.
Thank you.
Yeah, so make sure that you're reviewing, just to like quickly, I'll go over that one more time. So make sure that you read your pre-package form that's in the email that's sent to you when you book your appointment. Make sure you're filling out your consent form fully. Review the clinic flow or center flow that you are attending to make sure that you are aware of what is exactly is expected of you when you arrive. So at Greenboro, you book your appointment, you arrive with a mask. We will ask that you change into a new mask when you arrive. Please make sure that you are wearing the appropriate attire for receiving a shot. I know it's been like winter weather lately, but just a short sleeve shirt under a sweater would be good so that you can just roll up your sleeve and go. Proof of previous COVID vaccination, not necessary right now. Most people are only on their first doses. Make sure that you companions stay in the car outside unless needed for mobility. Otherwise, just make sure that you follow the flow and there are lots of people directing traffic, so it's a really smooth flow. You can sign up on the Ottawa Public Health website for COVID-19 vaccination updates. Really handy. Ottawa Public Health has lots of resources. Highly recommend that you use them. And then Ottawa Public Health, if you are not booking with a clinic or a pharmacy, this is where you go to book your appointment for the city sites. And yeah, questions. So Dr. Robert will answer any questions you have. You can please fill them out in the Q&A on the side, and then Christy can help to ask them.
That's great, Erin. Thanks very much for that. Dr. Weber, we just had one question here in the chat I'd like to bring forward. So just again, as mentioned by Erin, using the Q&A feature, if you type your questions in there, we will get that answered for you. So we just had a question here. It says, the mRNA vaccines have never been approved before for human use. Short-term safety looks to be very good. How do we know that it's safe long-term?
That's a very good question. I forgot to mention that we've been using mRNA vaccines for cancer treatments for over 10 years already. So we do, particularly for melanomas, so we do have some experience with that. Now, they're not used a lot, so we have a small number size of people. What we do know from the vaccine is, from other vaccines, is that we're stimulating an immune response. And proteins do not last long in our system. So when we get, say we were to get a vaccine that had the spike protein, it would not last long in our system. Our body would digest this protein very quickly. And when it comes to mRNA, the mRNA is extremely fragile, and the body reuses all mRNA, so it'll break it down very, very quickly. And so that's part of the reason why it needs to be cold that cold chain needs to be followed, because of its fragility. So the mRNA will get broken down by our body very quickly. And that's what the body does. So the vaccines have, yes, these are new vaccines due to a new disease, but the process has been around for quite some time.
Thank you, Dr. Robert. Just another question here. So some people are hearing that the first vaccine becomes less effective after 1 month if you don't get the second vaccine at the 1 month mark. Is there validity to this?
Yeah, so let me go back to my my slides. Just a second. Share screen. When you look at the effectiveness, where did I put it? So when you look at the effectiveness of the vaccines, just a second.
Just while Dr. Robert
Right.
gets set up here, there are some more questions that were submitted through email that we will get to.
So when you look at the effectiveness of the vaccines, you can see that after 10 to 14 days, the rate of getting COVID is very, very low. And so this is the 4-month mark. Notwithstanding that people are sort of saying this, we know from other vaccines that typically we give a booster anytime between 2 to 6 months following the initial vaccine. Some of you may remember that from the Shingrix, the shingles vaccine, and some of the other vaccines that the children get are often, hepatitis, for example, will have a booster 6 months after the fact. And we see that with the Moderna, same kind of thing. We're looking at 110 days and still virtually no big increase in cases. AstraZeneca, again, after the 10 days, you can see that it's very flat. People are just not catching COVID enough to be noticed following vaccinations. And again, Johnson & Johnson, which is a one-shot, so no booster, if you will, you can see that after 60 days, or roughly 8 weeks, only after that do you start getting a slightly increased rate of COVID.
Dr. Robert, there's a question in regards to a prescription. So this question has been asked in the prior town hall that we hosted, but the prescription that they're on is Consentix. It's a biologic, but in that same vein, could you just go over any kind of prescription medication or conditions that you should discuss with your medical provider prior to getting the vaccine? So just anything in general that you would want to discuss prior to getting the shot.
Yeah, thank you, Erin. So when it comes to these newer class of medications, we call them biologicals. So they tend to end up, their last letters are AB, so AB for antibody. They are very effective at controlling and sort of minimizing progression of diseases, of cancers. And you know, in the context of a previous question where people were worried about long-term side effects, immunoglobulins are foreign proteins in this case for these treatments. But after 90 days, typically they've degraded to the point where they're no longer useful. In some cases, they can degrade within a month, depending on which antibody is being used. So as a rule, because these vaccines are new, we do not know what the impact will be with floating antibodies. But we do know from other vaccines that the impact from the other vaccines is virtually zero. However, there are some biologicals that actually are a contraindication for the mRNA vaccine. So in that case, I would specifically just ask the specialist or the physician who initially ordered the medication if you're allowed to get one vaccine over another. Did I forget something?
No, that sounds like a good answer. I had a question sent in by email here. If somebody is taking birth control, is it safe for the patient with respect to blood clots to receive the AstraZeneca vaccine?
Yes, so the chances of getting a clot from the birth control pill is far greater than the chances of getting a clot from AstraZeneca. We have enough people who've received the AstraZeneca in Europe, and despite all the big media, there's been no connection to the birth control pill. It looks like it's an immune response to the vaccine, much like it is to an immune response to medications, as I mentioned. So in essence, it's the body is reacting very differently than most people. And so it takes some time for the immune response to develop, and that's why we seldom see any kind of issues immediately following the vaccine, but more the vaccination time, but more sort of 4 weeks or so afterwards. So I would not use the birth control pill as a reason to avoid vaccination.
Thank you, Dr. Robert. Just a question. I have a question here. It's a two-part question. I'm going to go ahead and answer the first part, and then I'll ask you for the second part, if you don't mind. So with respect to getting second shots at the Greenboro Family Medicine Center, we're currently in talks with Ottawa Public Health, who are unable to give us an answer with respect to when we will have our doses for the second shots. Currently, we are vaccinating for first doses only, as per public health. And the second part of this question, Dr. Robert, if you could comment, if I got the AstraZeneca vaccine as my first dose, could I get the Pfizer or Moderna for my booster?
So I don't know. In the context of vaccine shortages in other countries, I do know that that's being explored. But at this time, there is virtually no evidence one way or the other. Because we're generating an immune response and a booster response, it's probably okay. But because there's no evidence, no one's done it yet, then I really don't know.
Thank you. There is another question here. I'm actually going to take the lead on this one, just asking, with high-risk family members and being a caregiver for them, are they eligible to have the vaccine through the clinic sooner rather than later if aged between 40 and 50 years old? So with this being said, I should probably say that right now Greenboro is out of stock of AstraZeneca, and we are fully booked. However, this is, it looks like based on age category, you would qualify. What I would recommend is contacting Ottawa Public Health. If you go to their website, they do have contact there. If not, I will go ahead and type the Ottawa Public Health contact number into the chat area. They are going to be the best ones to ask for this question. And Erin, I will let you answer the next question, please.
I'm not going to actually answer it, but I'm going to add to it. So Dr. Rivera, this question is, if you have factor V clotting disorder, is it safe to get a COVID-19 vaccine, or should you wait? I just want to add to that though, because at the vaccine clinics, I get a lot of questions about any clotting disorder. So if you could just sort of generally answer, and then specifically for factor V, I assume also mainly in terms of AstraZeneca, since the clotting is of concern.
So we're getting a lot more information as time goes on about this. So the clot is actually has a name to it now. It's called VIPIT, or vaccine-induced prothrombic immune thrombocytopenia. It's a big long word, but basically it means you developed an immune response that triggers the platelets to clump together, and clump together in the context of forming clots, and therefore then you have low levels of platelets. The treatment for it appears to be best by using some of the very, very common blood thinners that we use right now. So what we're learning, and so this is still sort of very preliminary, but what we're learning is that if you have unprovoked clots, it still does not seem to be a contraindication to AstraZeneca. However, if you have sort of very specific questions, I would probably like factor V laden, I would speak with the hematologist and see. The issue here is that it's an immune generated clot, so it's a completely different mechanism of clotting. But if there are readily available vaccines, or if the community rate is very, very low, and that's neither the case in Ottawa at this time, then waiting for a vaccine might be worthwhile because you have those options. So to answer it, it's a very different way to clot. So the two are probably not related. And if you're unsure, I would speak with the specialist.
That's great. Thank you, Dr. Robert and Erin. If there are any questions, just a reminder, please to type in the Q&A section, just so that we don't miss answering them for you guys. We don't currently have any questions from you guys. Dr. Robert, do you have anything to add? Oh, well, actually, as I say this, I do get another question here. Would you be able to comment on the symptoms of this type of clotting?
Yeah, so again, it's very rare. So 1 in 250,000. So if the general symptom is much like a stroke. Okay, so if you have slurred speech, blurred vision, coordination issues, or a headache that you can't explain easily, and the timing is correct, so this will typically not occur within 2 weeks of the vaccination. It'll occur afterwards, because your body is generating an immune response. You do need time for that immune response to take off. So essentially, the signs of a stroke, as I mentioned.
Thank you, Dr. Robert. We just have a follow-up question here to the mRNA long-term risks, asking just a comment on the long-term risks of the viral vector vaccine options. Are long-term effects better understood with those?
The viral vector long-term effects are very similar to to most vaccines. We don't use a lot of viral vector. And simply because it's not called mRNA and they were not first out, I think that people are feeling more comfortable. The Zika and the Ebola vaccine have not had any long-term side effects that we have been able to note. And again, the virus is primarily protein and virus DNA, and those things are broken down very quickly in the body. So because they're broken down into their pieces, the building blocks we know are very, very safe. So it's when they're together that, so if you have a virus and it's all together, that's how it can, sort of replicate. But if the virus is dead, you can still see the building blocks, and they don't seem to cause any problems. So short answer is I don't see any long-term side effects from the viral vector vaccines.
Thank you, Dr. Robert. If I were to catch COVID-19, is there any proof of taking supplements that would help me fight off this virus? Vitamin D or omega-3?
So at this stage, that's a good question. So at this stage, we've been unable to find any supplements that make a difference in terms of improving outcomes. What we do know is that people who are deficient in vitamin D tend to be people who cannot fight health challenges of any kind very easily. So it's almost the reverse. If you are deficient in vitamin D, it's a sign that you may not do as well. But the deficiency is a marker for the fact that your body cannot fight infections well, rather than the cause.
Very interesting. Thank you. Can the AstraZeneca vaccine cause a flare-up for ulcerative colitis?
Well, that's a good question. It depends on the amount of stress that the person requires to get an ulcerative colitis flare-up, or any other, or even Crohn's disease flare-up. So when we are fighting any infection, we are under stress. And when we get a vaccine, it makes our body think that we're fighting a real infection when in fact it's a fake one. And so that stress is very similar. So if you typically flare up following a cold, then it's likely any vaccine would have a similar impact, simply on the fact of that the stress of fighting a fake illness in this case is very similar to the stress of fighting a real illness.
Dr. Robert, this is a follow-up to the just the explanation about mRNA and viral vector vaccines, but do you think that a vaccine will be released using traditional vaccine technology? So previous like vaccines that we have on the market now?
Yes, I do believe so. There's four basic ways of developing vaccines. And one of them is a live virus. So we're not going to be using live COVID. So for COVID, there's only three. Basically, the issue here is that it does take a lot of time to produce the spike protein. So when we have mRNA or the viral vectors, we are being used as the factories to build these proteins. So we don't need to make factories to make the protein and then put them in little vials. So now we just have vials of these factories, if you will, that we're getting, and we're producing the proteins. So there will be eventually some of those, but the delays in the production is what's happening. And we see these delays very often, even with influenza vaccines, for example, where the influenza vaccine will mutate, but we have taken 6 to 12 months to guess where it's going to be. And we have all these vaccines to fight it. So the beauty of the mRNA and the viral vectors is that if ever there's a slight mutation, once the mutation is sorted out, and the protein differences are sorted out, then the mRNA is tweaked, and we can develop a newer vaccine very, very quickly.
That's great. Thank you, Dr. Robert. We'll just give some of our attendees a little bit of time in case they have some more questions. So like I mentioned previously, guys, we were offering the AstraZeneca vaccine at Greenboro. However, we are out of stock and fully booked. And so if that changes, we will contact you by email. Otherwise, please visit the chat here. I have copied and pasted here the phone number right from Ottawa Public Health's website in order to book your vaccine, or call and check to see if you're eligible. They're very busy, so I'm sure they wouldn't mind your patience, but they will get to you and be able to help you schedule your vaccine. So it doesn't look like there are any more questions coming in. Dr. Robert or Aaron, do either of you have anything to add to the presentation tonight?
Thank you very much, everybody, for showing up. The fact that you're interested in the vaccine is very encouraging. Once we're able to have people not be sick in the hospital from COVID, life will return back to much more normal state. So right now we're doing everything. We're doing it well, but we have not come across a virus this contagious before. So we're all a little bit surprised. So please keep physically distancing, wash your hands, wear a mask, and I would wear a mask everywhere and anywhere, just to protect others. And then, if everybody were to do this, then we go back to doing the things we like doing.
I just
Agreed.
That it's very good that you did attend, and keep washing your hands, keep wearing a mask, try to stay home as much as you can for now, and we can get through this.
Absolutely. Great advice from two great healthcare workers. So at this time, I'd like to take the opportunity to thank Dr. Robert, Aaron, Brandon, for putting all your work into this and informing our patients, and just making them hopefully feel a little bit more comfortable with this vaccine. Thank you, everybody, for attending. And please feel free to visit our YouTube page after this. You may share this link with your friends and family, maybe perhaps people you know who are still hesitant. And we look forward to running one of these again in the future. So without further ado, thank you again, everybody. Stay safe and have a great night.